Welcome all to the National WIC Association and a Thousand Days panel on Black breastfeeding in honor of Black Breastfeeding Week, but also National Breastfeeding Month. I am Stacey Davis. I am the Health Equity and Community Partnerships Manager here at National WIC Association, and I am pleased and honored to be here today. Today, we will engage in a much needed conversation around health equity within the Black community, specifically inequities and systemic barriers that limit women's access to and participation in breastfeeding. And today I have two of our community's most phenomenal leaders who will be in the discussion today and also sharing information and their knowledge and expertise that they provide within their own communities and on a national level. So first, I would like to introduce our first panelist, Jania Mittenhall Williams.
Thank you so much, Stacey. Hello, everyone. My name is Jania Mittenall Williams. I'm the program director of the Human Lactation Training Program at North Carolina Agricultural and Technical State University, located in Greensboro, North Carolina. We are the only public historically Black college and university to have a Pathway to program in human lactation in order to bring in more diversity in the lactation workforce.
Thank you. And next, we'll introduce Andrea Serrano.
Hello, everyone. A pleasure to be here today. I'm Andrea Serrano, Program Director at Reaching Our Sisters Everywhere. Our organization is based in Atlanta, Georgia, but we're a national organization that's centered on addressing breastfeeding inequities, particularly for Black families, through trainings, partnerships, and programs. So excited to be here today.
Thank you, ladies. We're so excited to have each of you. So national data has shown that national initiation rates in breastfeeding have been less than ideal for Black women. Okay, so particularly in 2019, we know the initiation rate was about 73.6%, right? And this is lower than the national average, which is 84.1%. And we know there are many different barriers and challenges surrounding Black breastfeeding, particularly in the Black community. And we'll get into many of those things today. But specifically, we're going to address some of the concerns head on today and talk about the potential solutions that programs, particularly your programs, offer to communities in locally but nationally to help mitigate these barriers and challenges for Black women and their families. All right. And so, first, I want to go ahead and ask you guys to tell me a little bit. I know you shared about yourself and your organization, but tell me a little bit more about yourselves. Give us some intimate details about you and why you are choosing to do this work. Um, Janae, you want to answer that first?
Sure, I will. And I say this all the time when I am talking in front of audiences when we are discussing maternal and child health. Most people of color, and particularly Black women, get into this field or workforce because of the personal experiences that they've had. So that's why I chose to get into the lactation workforce after I had my first child. The hospital was going through the baby friendly process. They were revamping the marketing that they had on the walls, and they realized that they did not have any nursing families of color. So they asked if we would be willing to let them take a picture of me breastfeeding our oldest child and put it on the hospital walls. There it went. It then went into pamphlets for breastfeeding when folks left the hospital. And soon I was stopped by many members in the community, and they say, "Hey, you're the lady breastfeeding in the pamphlet that I got when I left the hospital. How do you do X, Y, and Z?" And I thought that they deserved a better answer outside of, just what I knew at the time. So I took the opportunity to go back to school. I went to a Pathway to program in lactation and became the first Black and first non-RN lactation in my hospital system in Greensboro. And after about 5 years of doing that work, I decided that I needed to make more folks who looked like me Because another thing that we take on when we are Black in birth work is, you want to save everybody. Well, I can't save everybody, so I need to make more people who can do this work and come across to the patients, and particularly those of color. And then I helped to create the Pathway 2 program at North Carolina A&T, where I have been able to make more Black lactation consultants. And we have 7 now that work in our hospital systems in our area.
Awesome. Thank you. Yes, and yeah, I think that is probably like the common theme about most Black breastfeeding supporters and birth workers is that the desire came from our own needs and lack of support in our own communities. I know that's why I became a lactation consultant is because I didn't know people who looked like me. I didn't even know lactation consultants existed, let alone that I could even be one. So thank you for sharing that. Andrea, can you share your story with us?
Absolutely. So I might slightly be the odd woman out. I don't have children yet, but my passionate work around maternal infant health, particularly for Black families, really stemmed from recognizing the impact that systematic racism has on the impact of our generation and generations to come. And there has been phenomenal work going on to turn back that needle that is impacting our outcomes. But in between, while we're working to dismantle racism in institutions, we are still having birthing families. And so, what I had remembered a video I had watched, a PBS docuseries, When the Bow Breaks, and it had really honed in on birth outcomes for Black families, regardless of social economic status. And that's what they always, when I say they, but research and so forth, always highlights as, some of the determinants to our health is that, higher social economic status means, better outcomes and so on and so forth. And here, this documentary was showing that despite all that, Black families weren't faring much better, regardless of having a higher socioeconomic status. And it really delved in deeper to what the impact of racism is. However, with an internship I had did in California at an organization called Great Beginnings for Black Babies, my mentor there really made me understand how much of an impact breastfeeding has on not only the um, parent, mama breastfeeding, but also for the baby. I always knew it was good to breastfeed, but to recognize the impact it had on the health of the current generation when we talk about maternal mortality rates, and an impact that it has on babies when we talk about infant mortality rates. I'm like, here is an opportunity to save 2 generations at the same time, to address some of the aspects of what systematic racism has caused, while we're still working towards dismantling systematic racism in our institutions. And so that's where my passion has stemmed from, and that's the lens that I use in the work that we do. So I was able to join the Rose team back in 2012. I was still in California at the time. And I said to myself, after I came for the first conference summit that July, I told my mom, all right, mom, I'm moving to Atlanta to do work with this nonprofit called Reaching Our Sisters Everywhere. And I have not left since. And through this organization, have been able to get lactation credentials to be able to better serve families. And also, as Janina mentioned, also work towards mentoring new lactation support individuals in this work too.
Thank you, Andrea. Yeah, I have personally witnessed Andrea on her journey from like start to finish to getting her CLC to getting her first college degree to getting her IB CLC. Like Andrea is rocking it out. Both are rocking it out. But I wanted to recognize you because I haven't seen you to be able to do that and say, I'm proud of you and you go, girl. Um, Thank you. So I know you guys touched on a little bit about your programs and your organizations. But I want to give you the opportunity to dive a little bit more because there's a lot of folks who know you and know your work very well, but there are some folks who may not know you and know what your programs are offering and providing to Black communities. And so I want to give you the opportunity to do that and showcase how, your programs and initiatives are helping to not just save lives, but, are diversifying our workforce because that's what we need. We know that, you know, lactation consultants exist in every state and every community, but very far in between do we see professionals that look like us, right? And so we know that professionals and having reflective care is very important and, you know, helps to alleviate a lot of those challenges that we face and gives us the courage and the strength that we need to push forward. Because we all know, like, Black communities, we strive when we're able to reflect what we see in our communities, either in our own personal social circles or in our family circles. And so, Andrea, tell us about all the phenomenal work that Rose is doing. I know you had the community transformers at one point. Is that still going on? I know that you have the summit coming up very soon. So tell us what you got going on at Rose.
Absolutely. So the Rose Community Transformer Program is still in existence. That is our community-based breastfeeding peer counselor training. And with what we call the panorama in place, we've been moving the training to a virtual space. So we are still doing trainings, even though they're currently virtual. So it's an opportunity for women that have previously breastfed that are interested in supporting other women and trying to get their feet wet in the lactation field of support to be able to learn the skills to do some of that beginner level counseling and join the network. So we have over 500 community transformers trained, and it's our initial program that we had started back in 2013. We recently created an additional peer training program called Breast Friends, which came about from us working on a national breastfeeding blueprint for Black families. And in that, some of the pregnancy risk assessment measuring system PRAM's data revealed that breastfeeding rates for our community for Black families goes down 21% each week after the first 4 weeks of birth, right? And so we designed that program to really centered on supporting a family through the first 8 weeks, having someone that is a peer, being able to give affirmations, help to elevate what normal breastfeeding is, and then be able to yield that family to additional support if necessary. And so that's a training that we're also currently doing virtual until time allows us to get back in person together. But the benefit of the virtual is that you can be anywhere and be able to participate in the training. Outside of that, we also host our annual summit, which is an opportunity for lactation support providers across the spectrum of support to be able to come in. We usually invite them to present as well, so they're a part of the agenda, and it's an opportunity to share about innovative programs, current research that's happening, and get some continuing education credits, because those are some things that once you start getting some of these certifications require some continue education. Outside of that, we have our Reaching Our Brothers Everywhere initiative, which is centered on engaging men in maternal infant health work, recognizing that it doesn't just need to be your significant other, it can be your cousin, your brother, grandfather, son, that can also help along your journey. So Robe, Reaching Our Brothers Everywhere does quite a bit of programming as well. And in between some of these things, last but not least, is our Queen Circle, which we're recently launching, which is centering grandmothers and their involvement around supporting their family with their breastfeeding journey. So we got quite a few programs, do quite a bit of national work as well in partnership with other organizations such as the National WIC Association.
Awesome. Thank you. That's great. That you are like, we know that fathers play a huge role in breastfeeding. And we want them to play a huge role in breastfeeding. But we also know, through research and just, viewing um, unofficially like family dynamics that grandmothers play a huge role in caretaking and providing advice around birthing and breastfeeding. So I think that's great that you guys are expanding the programs to include those because they are really the champions in making sure our babies are getting what they need and have a successful, thriving future. Jania, you want to share about your programs?
Sure. Thanks, Stacey. So we, as I stated in the beginning, are the only public HBCU or historically Black college and university to have a Pathway to program, which is the educational track to becoming an IBCLC or International Board Certified Lactation Consultant. We are in our third year, and what we do is we are helping to diversify the workforce of lactation. And in addition to that, we are building culturally sound lactation consultants. So just because we are an HBCU does not mean that every student who attends our program is a student of color or a person of color. We are interested in making culturally responsive lactation consultants. And our students are learning from each other. We're also the only Pathway to program that has an additional didactic course or the courses that assist you with the instruction of lactation. And that course is in cultural diversity and communication and healthcare. The one thing that I found out very quickly being a provider is people don't know how to communicate with folks who are different from themselves. And it doesn't necessarily just stay on race and ethnicity, it's also gender. It's also, people who are disabled, just anybody who's different from what people consider normal. And that's another thing I teach students. There's no such thing as normal because we built those ramifications. So let's discuss, what something is and how we can best assist that family with what they have. And so we have some really great things going on for our program. We are also the only Pathway to program that has their own outpatient clinic. We started an outpatient community clinic in the spring of 2022, so this past spring. And within a 7-week period, we piloted it to see if we were really making a heavy impact in those that we saw in the community. We started the clinic because after the first cohort graduated, when we looked at the breastfeeding rates at the hospital level, we saw that they increased between September and May, and they fell off in June. And the only thing that was different is we removed the students from the clinical settings because they had graduated. And so then we said, okay, what is this like if we put it into an outpatient clinic? And so when we piloted the clinic in the spring, in 7 weeks, we saw 29 dyads. 29 dyads, and we were only open on Tuesdays and Thursdays for 5 hours. So it was a tremendous impact on the community. We are now in the process of getting our own standalone clinic because then we're directly feeding our lactation consultants. We would hire the lactation students after they obtain their IBCLC to eventually run the clinic. And that way we keep everything full circle because you can never have too many outpatient lactation folks in the community because yes, we work with WIC and they have outpatient lactation, but we know with the pandemic, they're unable to see people in person at some WIC sites. And our community is one of those where we're only allowed, our WIC peer counselors are only allowed to see people virtually. That's really hard to do. So we picked up some of that slack and did that with the clinic. And we have funding available too for our students. We take 15 students each year, and each year half of those students get a full ride. And their books are covered for the next 3 years. So we are just looking again to diversify the workforce and to train more culturally responsive lactation consultants, all at the benefit of the community and wherever they may go to next after obtaining their IBCLC. And I forgot that too. We're able to cover everybody's IBCLC exam for the next 3 years too. Their registration fee, because we know it's hefty, because we're all about increasing the lactation workforce. And we don't want to be a burden for those who really want to obtain these credentials.
Thank you, Jania. Like I hear you talking a lot about how you're breaking down because breastfeeding is a barrier and a challenge in itself, and entering this
Mhm.
field is a barrier and a challenge in itself. That so many who embark upon this journey don't
Mhm.
realize the challenges and barriers that you come against. Because it could be not only is it time consuming and energy consuming, but it can be financially consuming with the cost
Absolutely.
of paying for mentors or, schooling or exam fees and books and so forth. So I applaud you guys for making this a seamless and effortless journey for, folks in your community and across the nation. So kudos to you
Thank
guys. I wanted to go back to a term that you used, and it was culturally appropriate or culturally sensitive. So a lot of folks may not know what that means. It may be a new terminology for some. So, can you kind of define that for us so people can have a walk away from this stream and have an idea of what that means and how they can support it from today on forward.
Yeah. So, looking at all of the diversity, equity, inclusion, or racial and equity conferences and courses we may have attended, especially after George Floyd over the course of the last 2 years, um, I have grown away from saying culturally competent because there's really no like end to understanding how other cultures change and behave. But within healthcare, it's best if we are culturally responsive to those we are working with because we know that culture impacts everything, especially interactions in healthcare. And so we should be striving to adapt or meet that individual's needs as we're servicing them, and when we're doing that, we are listening more than we are talking. In addition to that, we are not assuming or putting them in bubbles by stereotyping or generalizing them based on their ethnicity, race, sex, gender, age, right? So we're serving them and seeing them as a blank slate because, especially with breastfeeding and lactation, when we're working with nursing families, it's not cookie cutter anyway. And when we are providing services in healthcare, it should never be cookie cutter because it's individually tailored to meet that dyad's specific needs. And so that's what I'm talking about when we're talking about being culturally responsive, responding to that person and their culture and their needs at the time.
Thank you. Yes, I agree. Andre, did you want to elaborate on that? I want to give you the opportunity if you had something different.
I mean, if we was buying a house, I would co-sign on all of that.
Right.
'Cause, that's exactly what it is. And like you mentioned, listening. I feel that listening is such a skill we don't get a lot of practice on. And
Mhm,
in this work, when you're serving families, even outside of lactate, when you serving family, you serving people,
mhm,
listening is so important. How things are said, what's not being said, because
mhm,
there is a lot there, and I think when it comes to care and taking that time to listen, really edge towards being culturally responsive because there's things that you're able to pull out there, so not forming that response or what the solution is, in your head, because in that case, you're already not responsive in that. So absolute cosign.
Thank you. Yeah, I think it's also important, like when we're talking about culturally responsive, that, how we show up physically,
mhm.
what clothes
Absolutely.
we have on, the things that we choose to wear also play a role because sometimes that can be off-putting to some. Like if you're, more formally dressed than you need to be in like a clinic setting or something like that. I think you can intimidate folks,
Mhm.
by just what you have on, but also like, your body stance. Like, what type of body language are you using? Like, where are you standing? in comparison to the person that you're talking to. Because if you're looking down at someone, then that's also, a mechanism for intimidation, which can hinder communication between you and whoever you're serving. So, thank you for that. I think it's important for folks to take a look at how they're showing up when they're providing services to clients. Um, so I wanted to take a different route and talk to you about some things that you've seen that are continuing to impact communities, particularly Black communities. We've already talked about how important culturally responsive and sensitive care is, but are there other things that we should be doing, looking for, providing to our communities? And Jania, I'll let you jump in first.
Um, what I like to do is really find centering the voices of those in our community when it comes to birth work and finding out what their needs are. But as we're finding out what their needs are, finding out what is working, but more importantly, what's not working so that we can create true change. Because we have Andrea and I, because of the organizations that we're affiliated with, we're able to go to leaders in the community and say, hey, we talk to those in the community, and they're the people who you hospital systems and organizations and public health organizations are serving. This is what they're needing. This is what they're getting, but this is what they believe they should be getting. And we do too. How can we best work together to ensure that these things happen? And not only when we go to those meetings do we show up for them, but I always like to bring someone from the community with me so they're not just hearing it from me. I'm bringing an actual birthing person or a person who has birthed recently in the community and putting them at the table, because those with marginalized voices are usually never heard. Decisions are made all the time for folks, especially those who look like us, and we're not even in the room or present. And so how do we know that that's what we need? So that's what I think will assist with creating true change.
Thank you. So I want to touch a little bit more on the last part you said about, bringing those folks to the table and creating the change. Um, there's been some discussions around creating programs such as yours. And we all know like these programs can be very expensive. And then you have to know somebody who knows somebody to get the support and the funding that we need. And we often know like most of these programs, as you know, are usually programs that are started by folks who don't look like us. And so the challenge is often sometimes understanding that we have to sometimes look outside of our communities in order to put the things in our communities that we need to get that support and get our foot in the door. And a lot of folks kind of shy away from that and don't want to do that. Can you talk about your experiences or any solutions or advice that you have about, you know, going outside our communities to put things inside of our communities that we need and how important those voices are, in addition
Yeah,
to, having our own folks at the table?
definitely. My program was actually started by funding from a public white institution or PWI. And so you just have to really understand what the end goal is and kind of keep all the background noise out, because you know that the work that you're trying to do will better the community and have a better impact on those who will need these services. In addition to that, always know where your funding is coming from, making sure that that person is really an ally and what changes are they making within their own organizations or institutions. As far as DEI work or racially inclusive work, Andrea and I, in fact, are getting ready to start working on a project for the next 4 years from a huge funding source that will impact birthing folks and communities of color. And so just utilizing all the resources that are out there and building your own team of people who will help you get the work done.
Thank you. Audrey, did you want to add to that?
Absolutely. I think some valid points that, there's sometimes some wounds and aches and pains and some navigating some of the spaces you have to kind of get into in order to be able to make sure resources and opportunities are available to the community and shaped by the community. And so there's a lot of difficult and hard conversations that have to be had. Sometimes I've had to learn to take a deep breath because I'm a person, all my emotions reads on my face in some of these conversations. But what's important is, as mentioned, the end game of it. And so one thing that we always highlight is we need to pay folks for their expertise. And so whether or not there's a PhD at the end or MOM in the title or DAD in the title or uncle, whatever their expertise and lens they are bringing into this space is valuable, and their time is valuable and should be paid. I can show up to meetings and whatnot, and that's awesome in the sense that it's a part of the work that I do. But when we're asking someone to take time out of their schedule to come and lend their voice and perspective to shape work, it's important that they are adequately paid. And so that's something we've always lifted up. We most recently, because we get a lot of phone calls to our organization about research opportunities, this, that, and the third. And we've started asking questions, to those reaching out to us. Who is a part of the decision making? Who helped to create this research? Who helped to determine that this question, needed to be answered? What is the representation there? And if the answers don't hit home with the mission of reaching our sisters everywhere, we say, unfortunately, we can't help or participate. And that was something that we found to be very important when it comes to being responsive to our communities and making sure that our communities that we are working with are shaping how we move forward. And in spaces where we have to, take on some difficulty to get the funds, we'll go ahead and roll through it, and we debrief with each other to have our own little, mental health situation to, get ourselves filled back up. But the outcomes of being able to provide many awards out forward and those things are very important to us. So it's a tough road to navigate sometimes. It's awesome to be invited to spaces, but our thing is that we don't want to be the only person in the space, and so it's a worthwhile effort.
Yeah, I think that's been like the greatest challenges. Oftentimes in this work, we're the only ones in the space. And so we feel like a certain responsibility in making sure we can be the voice for, all our communities, but it's an impossibility for us to speak for every community because each one is unique and has unique circumstances. And
Absolutely.
so having the courage and the strength to say I can't do that is huge. It's something that I have had to learn myself. It's like, oh, can't do it. Like, so great. I want to switch it again, like switch gears again, because the hot topic is the infant formula crisis, right? And so everything that surrounded that. So tell me some things that you guys have done to mitigate the infant formula crisis, and what are some challenges that you have come across in that, and how can we help, those who are viewing continue to help mitigate those the crisis and support our families because we know there's been an increase just in breastfeeding alone just from that, but there's also been an increase of families looking for human milk alternatives that might not be safe. So what type of advice and support are you providing to your communities?
Mhm. So for me, one thing I forgot to mention in the beginning is I also run a lactation group, support group for families of color called Mahogany Milk. And we can be found on Facebook at Mahogany Milk Support Group and on Instagram as Mahogany Milk. what we did is we brought together some of the lactation folks of color in our community, and we held an educational panel on formula, human milk feeding, human milk sharing, because that's taboo often in our community, and the reasons why we should not be creating substances to sustain our children, such as homemade baby formulas. And just some of the questions that came up during the panel discussion after the education piece, it was very interesting because it goes to show you that education goes so far, especially within our community, when we create safe spaces for us to just interact with one another. I often call it the mirror mirror effect because I believe that people of color receive messages about healthcare better from other people of color. It makes us feel safer. And we built that trusting relationship. And we did this via Zoom, and we had over 60 people come. And it was just a real intimate time for folks to really get the information that we needed. We were able to connect families who needed informal human milk sharing. And we were really able to assist folks because so many people don't really understand the physiology that comes along with lactation. And I always tell people it's like an ice maker. You got to empty it and it fills back up, and you just empty it and it fills back up on its own, not understanding that that's how you keep this going. Because so many people go, okay, well, I'm gonna put the baby to my breast or my chest, now, and then I'm gonna give the baby a bottle just for no reason. If you have to bottle feed, absolutely do so. But if you have the ability to keep putting the baby to rest, especially in those early days, that's what's going to keep things moving and going. And just helping folks understand that barrier, that gap in education really went far.
Absolutely. Audrey, did you have something?
Yes, so a couple of things. When I tell you that the months was juggling central around here, so we do have a drop-in breastfeeding support kind of group with Rose. And so it's available on Mondays from 1 to 3. Since the panorama, it has been online, so everyone can, whatever time zone they're in, if they can make it from 1 to 3 Eastern time, us as lactation support providers are available to get that support. And if you're local to the Metro Atlanta area and we're facing breastfeeding problems, we do schedule a one-on-one in person with you here during that time as well, and offered at no cost to families. And so that was one thing we was, even if it wasn't on Monday from 1 to 3, we was navigating, calls and providing support. A few of us also on staff work at some of the local hospitals here, including myself. I'm a bedside lactation consultant at one of the local hospitals on the weekends. So when I say I was in there making sure, we were establishing lactation and, identifying ways to sustain and, so forth. And being able to connect families to community resources as well upon discharge was an important piece of that effort. Sharing out information as well about informal milk sharing. So that way folks knew, how to kind of navigate that process. The Academy of Breastfeeding Medicine does have some great guidance on informal milk sharing. So being able to share that out, working in collaborations with a lot of other organizations around sharing out how to go about relactation if that was a decision that folks were going to go ahead and pursue, along with um, tips on not alternative, unhealthy alternative feeding methods. There's a lot of suggestions that made the blog posts around. So making sure to give good information regarding that as well. And then also providing, resources to some families as like such as pumps and so forth. We did our best to navigate all those different roads that kind of came up around us and putting out solid information. And I think the most important thing was, recognizing that it wasn't a time to pin one group against another group at all. And I felt that, to some degree in the media, that's kind of what was happening. There was no lactation consultants going around hey, you should have went ahead and, and breastfed. Like, I was like, who's this person popping out of like trash can saying this? Like nobody that I know. But really just centering that, as a lactation support person, we are here to support your journey and be able
Yes.
to guide you through that. And I think that was the sentiments that most of the folks on my feed was also taking when it came to trying to support others. So that's kind of what we navigated. We did launch a initiative called um, HEAL, which is Health Equity for Lactation, specifically surrounding Black families. And our campaigning that we've been kind of doing is around building your village. And so this is where we kind of ramped up a lot of those programs I talked about early on, because a part of that success, families are only in the hospital for 2 days. They back home and in the community for the rest of their breastfeeding journey. So really ramping up, like, here are available resources and opportunities.
Awesome. Thank you. Yes, I think that, and sometimes, like, since the pandemic, like, it's been even quicker than 2 days. Like, it was already like vaginal birth
Yes.
was 24 hours, but now it's,
Mhm.
in some cases, people are getting out of there a lot sooner before they can even really see if breastfeeding is established or if they have any challenges that may be coming up, and they're missing
Mhm.
out, due to those early discharges.
Yep.
I want to start to wrap things up because we're coming close to the end of our time. But I want to, if you can, in 30 seconds or less, talk about how, even though you guys don't work for agencies, you partner with agencies.
Yes.
So can you tell us like what WIC can do to continue to improve the services that we provide in our communities in 30 seconds or
I would say that one thing that we do a really good job of in my community, as far as our WIC agencies are concerned, is checking in on the families shortly after they are home to see how infant feeding is going. Because we know that WIC works with families who are nursing and families who are formula feeding. And they also do a really good job of explaining to the families that they don't have to choose, just one singular package. They can get a package that encompasses both. And then they send the families who are looking to, utilize breast milk as the coverage in that gap, because we know that WIC is supplemental services to us at our Pathway 2 program, where they get to work with some of the students with assisting them with support of nursing and then sending them directly to our community clinic.
thank you, Andrea.
So Rose has had the opportunity to work with lots of different WICs across the nation, and we learned very quickly that every WIC operates differently, and
Mhm.
not even just every state, but like even within districts.
Yeah.
And so to say that the breastfeeding peer counselors that WIC have are a phenomenal asset to the program. We know that they might run a little differently in each state, and my encouragement is, ensuring that the breastfeeding peer counselor programs are well funded, that allow the peer counselors to operate as peer counselors, be able to connect and meet with families. I know some phenomenal breastfeeding peer counselors, here
Mhm.
in Georgia, that is now my home state. And I know what an impact it is to know that, your peer counselor is available to you to come see you. I know since the panorama, they haven't been able to do much home visits, but that makes such a significant difference in being able to have someone see you, someone you build a relationship with, and being able to kind of contact and connect. So I think ensuring that the program is well funded, that the staff is, well and adequately paid, and that they have the opportunity to really connect with their clients in a meaningful way, I think is so vital and important, and it's one of the beautiful aspects of the WIC program is the breastfeeding peer counselor program.
Absolutely, absolutely. And then if I could add, sorry,
Mhm.
um, if giving the breastfeeding peer counselors an opportunity to become IBCLCs if they choose to do so, working hand in hand with WICS and Pathway 2 and Pathway 3 programs, leading them to do, I guess, professional development within their WIC agencies. That would be extremely helpful because, again, that mirror effect. So many peer counselors come across, especially those say all the time, I wish I could become a lactation consultant, but I don't have the means to do so, and I'm not able to get that time off. Where they're already doing this work in the community, so why not, assist them with helping them with that professional development?
Absolutely, yes. I think growing our own in WIC is huge and important, and so
Mhm.
that is on my list of things to do at my time at NWA. So finally, I want to give you guys the opportunity to tell our viewers how we can support your work in your organizations. Is there anything that we can do to support you and so that your work is sustained in your communities, but also so that it can grow and be the phenomenal things that it has the potential to be? Andre, you want to go first?
All right. So I'll encourage all of you that are watching today to check out our website, which is www.breastfeedingrose, like the flower.org. So www.breastfeedingrose.org. Come on to our website. We have so many opportunities, whether that is if you're interested in any of our peer programs, if you're an organization, check out our HEAL initiative. We are looking to partner with that initiative. And those are ways that we can connect and grow from there. And also, I'm going to thank you all for the work that you are doing and the impact that you are making.
Awesome. And then for us here at North Carolina A&T, if you all have folks who you would like to send through to our program, and just to get more information about it, you can send us an email to our NCATP2, as in the number 2, P at ncat.edu. You can also go to the ncatncat.edu website and type in human lactation, and the information about our program will come up, as well as how to give to our program and to receive more information about our program.
Thank you. I know one of the questions is going to be, is your program a virtual program, a hybrid program, or an in-person program? So let's put that out into the universe before
Yes,
we all
let's put
get
it out into the
emails.
universe. You are correct about that, Stacey. So right now, our program is in person. We are thinking of how we can make this a virtual program or a hybrid program in the next 5 years.
Okay, well, thank you.
You're
All right.
welcome.
So I thank you guys for your time today and sharing your expertise and your experiences with me, but also those who are viewing today. I want to remind today's viewers to follow NWA in 1,000 days and stay posted to more events around National Breastfeeding Month and all the wonderful weeks that we celebrate during this month. Um, don't forget to follow us on our social media pages, on our Facebook, Instagram, TikTok, and LinkedIn pages. And that is it for today's broadcast. I thank you, and I hope you have a rest of your day.